Hi, I'm nursing student Jason. Today I'm going to be collecting a blood sample from you, from your central line. So if you have any questions, you can let me know, and if ever I cause you any pain, please let me know. Or if your site is sore. Right now, I just want to make sure that you're the person that my orders say that I'm supposed to do this with. Can I get your name and date of birth? Okay, that's you. And all right, I want to make sure you're comfortable. And I see you're already, you look pretty comfortable. Now, while we're doing this, if you could just look out the windows, because I don't want you breathing on any of the materials or any of the stuff. It's probably not such a big deal, but it's always a good idea just to not cough or sneeze or get your breathing germs on anything pertaining to your site, because it will. Although I'll be sanitizing it and I'm rambling, but anywho, do what you want. So right now I'm gonna go ahead and get my hands clean, do some hand sanitizing, get my mask on, get some gloves, some fresh gloves off the wall, and so I've got my materials. I'm going to open this up and want to grab this sterile field by the outside 1 inch. This is the downside, it's the shiny side. So I'm just gonna put that right there. And I'm going to, at this time, what I'm gonna do is I'm gonna clean this. So I'll make sure that this is clamped. Take a pad. Now I also would have I don't have a biohazard bag, but I'm going to pretend that there is a biohazard bag right here. So I'm going to go ahead and put that in my notional biohazard bag and open this. And now that cap I will not use again. And I want to clean this for 5 to 15 seconds vigorously. And put that in my bag. Now that's clean, and it's also, well, it's on a sterile field. So now what I'm going to do is I'm going to take my saline flush, or my saline syringe, and I'm going to use this to flush it and check for infiltration. So now, and I know this is clean, I just cleaned it. So I'm going to take this, and this is garbage as well. So now I'm going to connect that. So the first thing I'm going to do is I'm going to pull on this. Oh, and I gotta open this. I wouldn't get much out of it if that clamp is closed. I'm going to pull on this and just make sure that I get a little bit of blood flash right there. All right, and we have it. So now what I'm going to do is I'm going to flush this in a pulsatile fashion, feeling for any kind of swelling, asking if there's any pain, and make sure that it doesn't feel cool. I want to make sure that this is the line is placed where it's supposed to be. So I would inject or flush it with however much my organization's protocols say. Maybe it could be 5, maybe 10. But because this bag is only so big that's inside this chest, I'm going to stop right there. So, and I'm going to clamp that, and I'm going to disconnect this right here. Oh, one thing I didn't do, now that I didn't get the 5 milliliters that I'm supposed to make sure that this is, so I need blood. So I'm going to clean this. For 5 to 15 seconds. Go ahead and get another syringe. I wouldn't now that this is exposed to the air, I don't want to put that in there, so I get a different syringe, and I can put that in here like so, and then pull back. Oh, I gotta do this. I'm gonna get 5 milliliters. Okay. And now, having closed that, having clamped it, now I can go like so. And this I can discard in my biohazard bag. So I don't want to get any drops of blood on the sheet, so I'm going to put it right there. Pretend it's in the biohazard bag. So now I'm going to go ahead and I'm going to clean this again. For 5 to 15 seconds. I'll take these, put these right here, and I'm going to go ahead and get my syringe that I'll be taking my sample with. So this would be a sterile syringe, and so yeah, I'm going to connect it. I feel like I want to. Well, you don't know that this is sterile, and so I could use a sterile alcohol swab to clean this as well. So I'll say that I did that. I'm going to connect that, and so now I'm going to draw blood per the orders, and we'll say that if the orders say to draw 3 or 4 milliliters, then that's what we'll draw. So I'm going with 4. That's all right. I'll clamp that, and now I'm going to go ahead. I'm going to let that hang right there for a moment. And so this right here is my sample. So I want to I'm going to connect. This is sterile. I'm going to connect this right to my syringe. All right, and then what I would do is, for training purposes, I won't actually do it, but I would place that in here, and then this is a vacuum tube, so if I push it down, then the vacuum that's inside here would draw the blood up, and I can assist it, and yeah, and then this would be the sample that I need, and this is a sharp, so I would go ahead and put that in the sharp container without, well, hopefully sticking myself, and because accidents do happen, you gotta be careful. Now I would also write on here my name, or not my name, the patient's name and information, or I would probably have a printed label to place on there anyway, and just make sure that that is correct, and they would tell me if that's them. And at this time, so I would go ahead and place this in this specimen transport bag, seal it up, and I'll get that to the lab once I leave the room. So at the moment, what I'm going to do now is I have to come back here, and I have to get another.
I would just verbalize it. We don't have them right now.
Okay. So I get another swab. Get a clean swab, and go ahead and clean this up for 5 to 15 seconds. And then I go ahead and get a new one of these for it. Oh, but before I do that, I also want to flush it one last time, because I don't want the blood that's in there to coagulate. Okay, so I'm gonna put that right there, and I'm gonna go ahead and, all right, so now I can put, so I know I've taken 5 out, so I can put that easily in. All right, flush it with however much my organization's protocols tell me, and oftentimes it's 10. So now that's clean. Well, that's got saline in it. I can dispose of this. I'll just put that right there. And so I would now, because I want to put that on the tip, I have to clean it again. So always bring enough alcohol swabs. I don't think we have any in the drawer.
We don't. I was looking.
That's a stinker. So clean that at least 5 to 15 seconds vigorously. I can throw that away. And now I can take one of these and put that on here. All right, now I'll place that right there and that right there. And I'll clean everything up. Like things that are supposed to go in the sharps, go in the sharps. If I haven't yet disposed of blood or whatever, put it in the biohazard container and clean up. I can and make sure the patient isn't in any pain and make sure that they're in a comfortable position, make sure they have their call light, and I can go ahead and take off my gloves, hand sanitize, take off my mask, hand sanitize, and I think that is everything.